So let us look at what we call the systemic effects of blood pressure, of raised blood pressure. So we'll look at different systems. First, the brain. When a person's blood pressure is high, remember we talked about what happens to a tire when it's getting old and it cannot sustain the pressure again. It begins to balloon out. So what happens in the brain when blood pressure has been high for some time? Some parts of the blood vessels will begin to balloon out. And when they balloon out, they become soft. And any small thing, they will burst. And if they burst, what does the person have? The person has a stroke. If that bleeding is not curtailed immediately, either intentionally by doctors or by the body's own mechanism, the person will continue to bleed and die. These days, we've been having a lot of young people die suddenly of stroke. This is the major contributor because their blood pressures have been high and they have not noticed. Their blood vessels have ballooned out and of course, they won't know that, but it has busted and it has caused stroke. What else can happen in the head? At the back of the eyes, you have blood vessels. If that happens also to the blood vessels at the back of the eye, it can cause blindness. A lot of people have come down with blindness due to hypertension. So these are the things that can happen in the head. So let us go down from the head now to the chest. What do we have in the chest? We have the lungs. We also have the heart. So one thing also that can happen, remember, just like when you take salt, there's a lot of fluid. The heart's responsibility is to pump out blood. But what if the blood now gets too much for the heart to pump because of so much of fluid? Person can go into heart failure. So the heart is not able to pump blood enough to meet the body's demands. Certain parts of the heart can die. And that's when somebody had an heart attack, heart pain, chest pain. These are kind of things that happen with high blood pressure. What happens when it comes to the liver? The liver also maintains blood pressure at a particular level. So if that blood pressure is higher than necessary, it can cause failure. And the liver does a lot of job in the body. The liver clears out toxicities in the body. When you drink alcohol and all that, the liver is responsible. When you take medication, the one that is not being used is the liver. When you eat food, certain things that are not being used, the liver will take care of it. So imagine someone's liver failing. So that could be a complication of heart failure, of hypertension also. How about the kidneys? The kidneys are very important also for clearing out impurities from the body. But they only can tolerate blood pressure within a certain limit. When a person's blood pressure has steadily, continuously exceeded that limit, it's just like a dam. So a dam holds water. And from that pressure within the electricity is generated. But if the dam is not built well, or if the water pressure exceeds what the dam was built for, what happens? It breaks and there's flooding. That's exactly what happens to the body systems, including the kidney. It can only hold a particular amount of pressure. And beyond that, it will start to damage. And that's where people start going into kidney failure. A lot of times, at least 70% or 60 to 70% of times in Nigeria, when people go into kidney failure, is because of pre-existing hypertension that has not been noted. So you can see, even within your body system, even within your muscles, your skeletal muscles, your bones, all those things need blood pressure at a particular level. Your lungs need blood pressure at everywhere needs blood pressure at a particular level. So once the blood pressure is higher than that, then we are talking about complications now that may arise. So, how do we then identify some signs of hypertension? You stay and persistently you have headaches, especially if the headaches are at the back of your head. Sometimes your vision gets a bit blurred. You cannot see very well. These are signs that you need to see someone. You cannot see properly. Apart from being blurred, you can't really see properly. Sometimes your head is spinning. These are signs that you need to see someone. Sometimes you feel like your heart is beating too much, too fast. You need to see someone. You have chest pain. You need to see a doctor. Okay? And then how to prevent hypertension. So I'm sure with all I've said, you can already have an idea of how to prevent hypertension. The food we eat has a lot of carbohydrate. So we must curtail the amount of food or amount of carbohydrate we eat. It should be a goal to eat earlier in the evening rather than late, because when you eat late, it goes and stores the fat, and fat is not good. It's also ideal to reduce alcohol consumption, because alcohol is also a contributing factor. Try as much as possible to avoid smoking, because not only does smoking cause hypertension, it causes several types of cancers. The thing in the cigarettes there are what we call oncogenes, or they cause cancer, carcinogens. So you need to avoid nicotine, and not just smoking it, being a secondhand smoker, being in a place where people are smoking a lot, you need to avoid it. Weight management. If you look around you, how many people who are extremely overweight or fat or obese get to the age of 70 or 80? Few people. So it means that obesity can also be implicated in death. So it means that if we manage our weight, then we can reduce our chances of having complications. And one of those complications is hypertension. Okay. And when these lifestyle modifications are not enough, also add that avoid eating too much of salt, and doing exercise. Exercise can be as little as walking intentionally, riding a bicycle. Easiest thing is running, jogging, be active. A lot of people walk, so they sit down on chair morning till night. So try to make sure you are a bit more active than that. So what if all these lifestyle modifications are not able to help? Then you need to see a doctor. You need to check your blood pressure regularly. As a young person of 40 and above, at least have your blood pressure checked once every 2 months. It helps to have an idea, because remember that one of the major causes of hypertension is genetics. So it's not something you can avoid. So if you don't check your blood pressure, how will you know? You can be doing all the exercise, eating all the right things, but you're already predisposed genetically. If you ask your father, maybe he has. If you ask your mom, maybe she has, or somebody in the family has. So you must check to make sure, and so that you can intervene appropriately. A young man who in his early 30s here in the UK, Nigerian, planning to get married, just got settled and everything. Regular Sunday football, and they were playing. Somebody passed the ball to him. And what happened? They knew him as a very good football player, but somebody passed the ball to him and he stood and he looked at the ball. He looked up, everyone was confused, but he had gone into an event. Everyone was confused. And somebody came, biri, 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 carried the ball and went another. But somebody who knows the guy looked, see, there's something wrong. And as he stood before, boom, on the ground, he managed, they resuscitated him, took him to the hospital, found out that he has a bleed in his head. So maybe his blood pressure was